Good morning and welcome to Radio Friends on Friday, February the 12th. And we have one of our favorite doctors, Dr. Anand Chockalingam, with us. Good morning, Doctor.
How are you, Paul?
Good to have you here. One of our favorites, actually one of our most popular. We were talking before you came in here, one of your segments, and we're going to talk about it today, fasting. Segment we did, a couple of years ago?
January of 2019.
Yeah. It had how many views on YouTube?
I think close to 185,000 views.
185,000 views. People wanting to find out more about fasting. And you've written a book. It's called Seeking Hunger, How Food Shapes Our Thinking, Our Health, and Our Destiny. Now, you are a cardiologist, and you feel that fasting is good for us?
Yes.
Okay, you have been fasting how many years?
I started fasting in 2018, and this was in the summer of 2018. By a few months, I had realized this is going to be one of the most effective tools to help my patients, because everything else that we prescribe, we don't take, like medicines or stents or even surgeries. We don't do it on ourselves. We just do it for the patients to get them better. But this is something, it has to start from within. So for me, it was first a personal exploration. And now I feel I have the confidence to take it to the people and use it to get better health for everybody. Anybody from the age of 10 onwards can embrace fasting. Above the age of 18, for sure, once a week, fasting could make us stronger, not only physically. See, when I came here and discussed this 2 years ago, and I want to thank so many people who give such encouraging compliments. 2 years, we have now 180,000 people liking it. And I got some of the questions they had asked. So one of the questions was, is fasting safe for women? The answer is, if we have certain conditions we don't want fasting, like eating disorders, liver failure, and pregnancy, breastfeeding. And if you're underweight or having eating disorders, we don't recommend fasting.
Okay.
But for most of the world, even diabetics, that was one of the questions. Can high blood pressure, diabetes, thyroid patients, people with sleeping disorders, can they fast? The answer to all those people is we are finding that fasting makes these conditions so much easier to get rid of. Actually cure. We can even reduce the medicines. Last week I gave a talk for the psychologists and psychiatrists taking care of depression, anxiety, PTSD, fibromyalgia. What I wanted to share with them is my personal journey over the last 2.5 years, where we've seen with our own Missouri patients. I take care of only cardiac patients. That's my job, taking care of heart patients. But they end up having, by their 60s, 70s, they end up building so many other health issues. Psychological health issues, mental stress, depression, and medical problems like diabetes, obesity, hypercholesterolemia, and high blood pressure. All these conditions that I just told you, they get so much better if we can give holiday for food once a week.
All right, so what you're saying then is 1 day a week, give up food.
Yes, completely. So just drink water.
Completely.
And even more important, I'm going to tell you, this is the thing that I've realized for myself. And today, the last patient I saw, if we talk about him, we'll end up spending the rest of the 8 minutes. But in short, he is 65 and he has really turned around. He's now feeling 20 years younger despite having such a weak heart. His ejection fraction is only 25%. He has a leaky valve and he's lost about 30 pounds already in the last 3 months, and he's so much better because he's not putting any food in his body once, or maybe even once in 5 to 7 days, he's not putting any food in his body. That's what has made us turn around.
You're saying start off, just give up food for a 24-hour period. Doctor, I have the greatest respect for you, but I that just seems so difficult in my mind to do.
So it was challenging for me for the first 3 months in 2018. By 2019, I was fine with it. Now we are taking this program to doctors for them to cope with their stress and burnout. We are taking it to schools and college students so that they can do better in their academic world. And now in this COVID world, everybody is dealing with more stress. So for everybody, I'm thinking, unless you have those things that I discussed first, we can try this on our own terms. We don't need a doctor to prescribe this. If you think you don't have insulin requiring diabetes and you don't have liver failure and you're okay otherwise, your body will learn over the next several months that it's okay. And it's actually not just okay. This metabolic switching or natural ketosis is what the program. First 4 hours, the stomach is empty. After that, if you don't put food into the body, by 12 hours, the liver stores are depleted. And after that, the only way we can keep ourselves up and around is if we start using the fat in our body. So that's what is metabolic switching or natural ketosis. And today what I want to bring to you is in the last 2 years, it's not just that metabolic switching and the physical benefits. I feel much more important and much more basic is the empowerment, the confidence patients get. Doc, now I finally have some control over my health. And that's what gives them the confidence, optimism to deal with so many health problems and get better.
So let me get this straight. You say, as long as you're basically in good health, you can go 1 day a week and not eat at all.
Yes, yes.
Drink water. You don't want to get dehydrated.
Correct.
Can you drink as much water as you want?
Yes.
Can you drink coffee?
Little bit of tea or coffee is fine.
But no food?
At all. So water is the friend, but even more important is the smile, 20 times an hour.
And you got to smile 20 times an hour.
The reason I come back to the smile as the first step is because that gives us the confidence and the openness and the gratitude that will give the strength to stay without food. That is the foundation of this fast. And when just these two things are combined, fasting with the gratitude and the smile, you don't need a doctor after that.
Then when you start eating the next day, everything is back to normal until your next fast day. And should you keep that fast day the same day every week?
It doesn't have to be. See, this is part of the natural thing.
What are you doing? We're just about out of time here. But you're not going to mess up your metabolism.
We are going to help our metabolism become more resilient. Physically, mentally, spiritually, in every way you'll find that you're stronger.
If you want more information, it's hilifejourney.org, HILIFE journey.org. Dr. Anand Chockalingam, thank you so much for visiting with us. And the book is called Seeking Hunger. It's available on Amazon. You are absolutely, really interesting person to talk to and very nice. Very, very nice.
Thanks so much for having me.
Yes, I love that smile of yours, Doctor. We're out of time. We'll see you next time. Bye-bye.